In a fast-evolving healthcare environment, high-value pharmacy education is vital. The Division of Pharmacy and Optometry, School of Health Sciences at the University of Manchester, is focused on the importance of research in teaching and practice-based education. Let's see now how this is driving the pharmacy profession forward.
At the University of Manchester, they're reinventing the role of the pharmacist. The aim here is to produce a skilled workforce that contributes more meaningfully to healthcare. There are 6 divisions here, including pharmacy and optometry. Professor Kay Marshall is head of the School of Health Sciences, or SHS.
Health Sciences sits within the Faculty of Biology, Medicine and Health. It's a very large, multidisciplinary, multi-professional faculty. In fact, it's about the size of an average-sized university in the United Kingdom. Being in this kind of environment gives us lots of research opportunities, as well as teaching opportunities. We're sat in a dispensary now, but going forward, pharmacists won't really be in this environment very much. They will be talking with other members of the healthcare team. They'll be working in primary care, delivering their expertise on medicines to where it really matters to the patient.
Which is why face-to-face sessions and ones like these with simulated patients provide vital opportunities to teach students practical skills.
We've had opportunities, for example, to go to hospital placements, community placements, and visit the GP as well and see how they work. There's been opportunities to go to AstraZeneca as well, have a feel of what industry pharmacy is like. So lots of learning opportunities.
One of the things that's really important that a pharmacist can do is have the knowledge and skills to be able to convert a drug molecule into a dosage form that a patient can take. So that could be a tablet, a capsule, an inhaler, a transdermal patch. Because if we cannot do that, then we can't deliver a drug to the site of action in the body, so it can't exert the desired effect.
Key to the future may be data science, which is also part of the undergraduate and postgraduate curricula. The university believes it is vital for pharmacists of the future to be able to interpret data and research and use it to improve healthcare and patient safety. Niels Peek is Professor of Health Informatics at the university, which has designed a system that uses smart algorithms to help GPs and pharmacists target high-risk patients. It's called SMASH, or the Salford Medication Safety Dashboard, and it could potentially save the NHS billions of pounds.
We've built a tool that helps pharmacists to quickly identify patients that are at risk of an adverse medication event due to the drugs that have been prescribed to them. And they work with GPs, so the tool allows them to identify those patients and propose a mitigating action. And typically that action would be implemented by the GP.
So far, it's been rolled out across 43 general practices in Salford. The number of patients at risk has dropped by almost 50% over the last 18 months.
These two are oxygens.
Staff and students are also contributing to internationally recognised cancer research. Sam Butterworth is a senior lecturer in medicinal chemistry and says both undergraduates and postgraduates contribute to the university's research output.
We work in particular on triple-negative breast cancer, so there's about 50,000 new cases of breast cancer in the UK every year. If the breast cancer is driven by hormone receptors or another protein called HER2, those patients actually have fairly good prognosis now. But patients that don't have cancers driven by one of those two changes basically have a very poor prognosis. We call them triple-negative breast cancers. So our research really focuses on new drugs that target specifically that patient population.
It's easy to see why many believe the University of Manchester is a one-stop shop, translating research into practice and teaching, as well as working with the industry to create future opportunities for pharmacists in the 21st century.